Alright, so let's recap again. 8-year-old child, presenting with nausea and a headache for a few weeks, no medical history, and vision 20/40. So.
You did that.
So yeah, we did the right eye. There's a little zoomed up.
Yeah, so just highlighting the same things, looks like optic nerve head edema.
Well, are your vessels obscured?
No.
Any hemorrhages?
No hemorrhages, no obscuration of the vessels, just looks elevated and some
There's something else to be
blurred
seen.
margins. Oh, am I missing something?
Any deposits in the nerve?
Maybe
In the,
this,
Where else?
possibly here.
it might be. Which is unusual for an 8-year-old, but in this case, you kind of can see some stuff. And then how's the vascular branch?
Did you take the photo?
No.
You have a good photographer.
Well, it's the Claris. When it's in a good mood and it's clean, it does nice pictures. Is the vascular pattern normal? It's pretty good.
So it's like trifurcation.
Yeah, it almost looks like a triangle. Like if you look at the vein kind of splits into 3. Yeah. But the artery does 2, 4, so.
Can you see this on physical exam?
The
8-year-old, yeah,
Deposits there?
it's easier on a picture with a kid.
You can see so much more in a class than you can
Yeah.
clinically. It's not bad.
And then you can just zoom right in on that. There you go.
So left eye, similar appearance, no obscuration of the vessels or hemorrhages. But does appear elevated. And hyperemic, also no cup, and then deposits. I can't really appreciate, maybe something there,
Yeah.
maybe there.
It's remarkable how white that stuff is, isn't it?
Is it hyperemic?
Yeah, it's elevated. some.
It's elevated.
I call it the chunky nerve. Yeah, this is the chunky.
It's not, it's not. It's
Not,
Physiological.
it's actually sort of whitish around.
It is lumpy bumpy.
on the
Bumpy.
edges, yeah, I agree, I was referring to that as sort of like elevation.
Yeah.
And you can see the vessels look like they're elevated.
You cannot tell that.
Trifurcation?
You're projecting.
Am I?
Oh, yeah.
Okay, so it's the IR of the right eye. So macula looks normal. Around the nerve, you can see some hyporeflective areas, I guess more than you normally would around the nerve,
Yeah, they are.
maybe some striations.
You could go.
No fiber there.
There's the one.
Okay, this is the autofluorescence.
Yeah.
So you have some hyper autofluorescence, several dots here. Could correspond to some of the deposits that we were seeing.
Ooh, baby.
And then same thing here, some hyper autofluorescent areas around the nerve. Okay, this is a OCT RNFL.
It's an EDI over the nerve. It's hard to get that. What you're looking for, I don't think is here. The big things are the vessels. So those are, the circles are the vessels. What you're looking for is if you can see any circular deposits. I don't think there's any there. Do you think there is?
They're like so they always have like the hypo,
This
should be
here,
the reflective spot with a reflective border. Like this.
So that one, if it goes all the way around.
And these are like these other deposits they were talking about. I think some stuff I read, but yeah, what they said is a hypo-reflective, like round
Center.
and then with a hyper-reflective edge.
All the way around.
I have to start.
Okay.
Same thing.
same thing in the left eye. Yeah, maybe some deposits here.
Yeah.
Maybe. Or the same.
This could be vessels, but that one, no. Where the front and back light up, and those little circles.
This right here.
No, that's a vessel. It's so hard to tell. I think these
Yeah.
guys, I mean, that might be a vessel, it might be a drusen,
Mm,
like this one.
There's, and then I guess also by,
This,
yeah. what about them?
oh, okay,
Yeah.
that's interesting.
Like Marilyn Monroe.
So the fluorescein is supposed to be your big, the fluorescein is supposed to be the most specific. So you look, what do you think of the fluorescein there? Go ahead.
So. So far looks, what are we at, 14 seconds?
Yeah.
So far looks okay.
That's 6 minutes, right? So that's a real early and real late. Or that's a peak and a late. So do you see a lot of leakage on the nerve, a lot of hyperfluorescence?
Not a lot, but
Just that little ring,
Yeah,
the
just the ring
nerve's
around.
not lighting up.
Why is it shaped like a bean?
What's that?
It looks like a bean, and
Yeah.
it's not round.
Yeah, that's because of that stuff around the nerve, which I think is probably backed up axons. I think, I'm not sure. That's a funny thing, that white ring around the nerve.
Is there also higher contrast between vasculature and the background chlorine?
Yeah, because it's a kid.
same thing here, not a lot of hyperfluorescence.
If this were
around it.
leaking, it would just light up, like you barely see the vessels, and
Yeah.
it would be so white. If you had, I'll have to bring in a case of discodine with the fluorescein, but if it's a discodine with the fluorescein, just like you barely see vessels there at the end of the nerve, it's so white.
So just summarizing the findings, so we have an elevated optic nerve head with blurring of disc margin and without any obturation of vessels, also trifurcation of the vessels. And then you have hypoautofluorescence with the nerve, autofluorescence. You have the lumpy bumpy internal contour of the subretinal hyporeflective space. And then the hyperfluorescence within the nerve on FA. And so at that point, when
The top of the differential is the optic nerve head drusen, pseudopapilledema.
then,
And then the other is pathway, which is a big deal.
so
Cause you have the symptoms.
Yeah, that's what I
What
was
was this?
thinking that.
the MRI was done, was normal, spinal tap was not done, a month later headaches are gone and the nausea is gone. So this is optic disc drusen. So what are they? They're aircellular deposits of calcium, acids and nucleic acids and mucopolysaccharides formed in the filament optic nerve head. They're classified as two types, either superficial or buried. Typically, they're asymptomatic, but the most common association is visual field defects. They are also associated with vascular occlusions and AION, all the very low association. And then it's the buried type that are most frequently misdiagnosed as papilledema because they're a lot harder to see and pick up. And then so the epidemiology is, 0.4 to 3.7%. Majority of the cases are in both eyes and typically occur in Caucasians. There's been some genetic studies because it does seem to run in family that there's had some correlation with genetics, but haven't been able to identify any specific gene.
If I'm seeing one of these kids where you can't tell if there's a parent of it.
It's a
Great
tough
idea.
call to, like if a patient's symptomatic,
Yeah,
to
this
not
is,
work it on.
to not yet. That's why they got the MRI. We kind of treaded water on the LP.
So like I said before, there's two classifications, the superficial and the buried. It's superficial if the optic disc appears elevated, nodular, and with blurred margins. And then on buried, there's no evidence, if there's no evidence of lesions that can be detected by ophthalmoscopy. Buried drusen more frequently found in children and become visible with age or increase in number. Visual defects are the most frequent associated sign, 51% of children and 75% overall have some sort of visual field defect.
And what's a typical defect? Let's see if we do. Is it like
Hard
image
depends on
change?
where it is, right? Hard depends on where the drusen is.
But there's some board questions
Is
about
it
it. It's like,
popcorn?
Is it essential sequel?
I thought it was like paracentral central people syndrome like that.
okay,
But,
Oh, yeah.
So the diagnosis of it, superficial optic nerve drusen appear as elevated disc and having a nodular appearance. And blurred optic disc margins without obscuration of the peripapular retinal vessel.
Here's a pointer. I've had a lot of Drusen and I've never seen that.
Yeah. So
That circle, I'm always looking for that image.
Seen what?
That circle with the ODD in it,
yeah,
on the image. That's like such a pretty, you always see the vessels which are on the right. So you see
Yeah.
the ones on the right where those are vessels. You can see the hyper reflections, a little front and back, but that's a Drusen, but I've not gotten an image like that.
Yeah, so that's what I was kind of trying to, maybe the one in your picture was like a smaller version of it,
Yeah,
you
maybe.
know, but yeah, you have the hyper reflective margin with a hypo reflective core. And can be seen on OCT.
If I may ask,
That's what-
why do we get vessel or trifurcation?
I think just the genetics, because it's a genetic, so it's a part, it's like a spectrum, it's like one of the things. Like a spectrum,
Okay,
Yeah, and they also,
it's like a code orange with angioid streaks, just they're associated,
okay.
Yeah,
they're not from it. I don't think, but maybe, yeah, whatever it is.
I don't know if it's like, because I think of like a flower, like stem, if you will, and it has like, leaves that kind of come off it, and if you kind of have something surrounding all that and you squeeze it together, it looks like, and you were to look down like a flower straight on, it looks like it's all kind of coming from the same place. Is it just because it's congested and the vessels are packed together and they look trifurcated, or it's like they're actually,
I think there's actually supposed to be an anomalous branching pattern.
okay, interesting.
yeah, and there's a lot of like theories on, you know, what optic nerve drusen come from, or it's like embryological origin, it's like certainly associated with hypocalcemia. And they said, like, in the whole embryology process, it might be pushing on the vasculature and stuff like that, that causes. Okay, so I just go through kind of some of the imaging techniques that we can use to diagnose optic nerve drusen and what those look like. So on D scan, which previously used to be considered the gold standard, they appear as hyperechoic, highly reflective round structures with posterior acoustic shadowing. And very drusen are typically hard to see on it, but there's your example, you see the hyperechoic and highly reflective drusen there.
The shadowing here, it's hard to tell from just a normal optic nerve shadow.
Yeah.
So it's the hyperechoic.
And what the typical image you'll do is you'll turn the gain way down. So the eye will disappear and the drusen will still be there. So that's your standard way to do
Is the
it.
B scan normally, so you do have some hypoacuity right behind it, right? And there's just the top of it looks super hyperechoic.
Yeah.
Yeah, because the
Yeah.
nerve is normally.
Well,
Not even the nerve, just the actual drusen.
Yeah, the drusen will brighten up, but it's hard, this scan doesn't show, the classic scan is where you do this and then you spin down your gain while holding the probe, and then it should, everything should disappear with the drusen, or at least become faded.
And you also do a CT scan and they're able to show only calcified drusen. Sometimes they're not calcified and they won't be visible. And then also there's like a certain size where it won't be able to see it. So
The hard thing is the kids, because they're not calcified, so
Yeah.
it's real challenging.
Yeah.
That's exactly.
and then autofluorescence has pretty high sensitivity for superficial drusen, but the buried drusen are more typical, and then you can see the hyper fluorescence here,
So where you need
hyper
it,
autofluorescence.
it's irrelevant. It has a low sense. You need it for the very drusen, you can see the superficial.
Yeah.
It's actually.
And then on fluorescein angiography, this is what they they consider extremely helpful for, because on disc edema, it's very apparent that you have, this bright area of fluorescence when there is disc edema, and if you don't have that, you're likely dealing with optic nerve drusen. So you see nodular disc staining, delayed filling. There's present in about 90% of visible ODD and 25% of very ODD, talking about the delayed filling, and then or the disc staining, and then it's useful for differentiation, like I just said, and you get early fluorescein leakage with edema, and you get late peripapillary staining with drusen.
But you keep touching the photo, that's a photo of edema.
This is
right?
edema.
All of that's edema,
This
right?
is all
All
these
edema.
are edema.
Okay.
This is just the early going.
The obscuration of the vessel.
And then you also get optic. And then on OCT, which is actually what I read now, the gold standard. Considered because you can visualize both the superficial and the very Drusen with OCT, especially EDI OCT. And specifically kind of what we went over earlier, but you can see the hyporeflective spots.
Vessels, you're right.
And then the other vessels,
I think part of it's where it is. I think the vessels are more in the middle.
yeah.
And the Drusen are more on the edges, but it's a real bear to tell.
And then they can cause decreased RNFL thickness, and it's correlated with obviously the amount of Drusen you have and how big they are. And they actually typically predominate the nasal side of the nerve. And then in terms of management, most of the time it's just observed. If you do have visual field defects that keep worsening, then you kind of just treat it like glaucoma with IP drops. But yeah, that's all.
I heard once in a video where someone went in surgically and picked out the Drusen,
Wow.
and I don't think it helped the patient.
So
Yeah.
this photo, so it shows like early and late. So I guess these ones are kind of a little more, actually look more obvious. They're actually considered early Drusen. And these are late. And then these were another type of finding. I can't remember the name for it. but-
Optic nerve sheath decompression.
Yeah, that's what this patient had. He had all that stuff next to
Yeah.
him, which was kind of funky looking. All right.